My name is Beth, and I'm a speech and language therapist working as part of the adult community team in Cornwall. This resource aims to give you an overview of what makes for an appropriate speech and language therapy referral for swallow assessment. We hope that it will support you to feel confident in recognising when and when not to refer. We recommend that this be viewed in conjunction with our accompanying video titled Introduction to Oropharyngeal Dysphagia. Dysphagia is a broad term that simply refers to swallow difficulties. It covers difficulties at the oral stage, pharyngeal stage, and esophageal stage. Speech and language therapists assess swallow difficulties at the oral and pharyngeal stages. The gastroenterology team assess difficulties at the esophageal stage. Signs and symptoms of oropharyngeal dysphagia include coughing when eating and drinking, increased breathlessness when eating and drinking, persistently clearing the throat when eating and drinking, recurrent chest infections, a bubbly or husky voice when eating or drinking, a sensation of food sticking high in the throat, and choking episodes. All of these symptoms may be an indication that the person is at risk of aspiration, which refers to food or fluid going down the wrong way. If one of your residents is presenting with any of these symptoms, in the first instance, check that safe swallow strategies are being implemented. You can access information about safe swallow strategies on our accompanying video. If safe swallow advice is followed and the person continues to present with one or more of these symptoms, then we would advise that you make a referral to speech and language therapy. When someone has oropharyngeal dysphagia, they may also present with the following symptoms: taking a long time to eat meals, difficulties chewing, sudden and unexpected weight loss, decline of food or fluid. However, if these symptoms present in isolation in the absence of any evidence of swallow difficulties, they do not necessarily constitute a need for speech and language therapy referral. The following signs do not indicate a referral to speech and language therapy: difficulty swallowing medication. This needs to be discussed with their GP or pharmacist. Speech and language therapists cannot give advice around medication changes or modification. Refusal of food or fluid or reduced engagement at meal times. If this is not accompanied by signs of oropharyngeal dysphagia, then it does not warrant a referral to us. We would recommend discussing with the person's GP. A persistent or chronic cough that is not solely related to eating and drinking. Any weight loss in the absence of oropharyngeal dysphagia symptoms does not require a referral. In this case, we would advise that you refer to the dietitians. Behaviours around eating or drinking that are subsequent to reduced cognition, such as oral holding or pouching. This can be managed effectively by nursing and care staff. It might be useful to view the accompanying video, Introduction to Oropharyngeal Dysphagia. Difficulties chewing due to reduced dentition or poorly fitting dentures. Intake gradually reduced as an expected progression of end of life, again in the absence of any oropharyngeal dysphagia symptoms. Tube feeding problems. This needs to be referred to the specialist gastrostomy nurses. And esophageal dysphagia without any oropharyngeal difficulties. Symptoms may include reflux, dysmotility, vomiting, and regurgitation. In this case, please request that the GP make a referral to gastroenterology. In addition, please be aware that we do not accept referral requests for reassessment of swallow where there is no identifiable change in presentation, for example, if the recommendations were made some time ago. If you need to make a referral to speech and language therapy, you must complete a referral form. The form needs to be completed in full in order that we can prioritize accordingly. If there is insufficient information, the referral may be rejected.